Some people think V is for vendetta, but when it comes to patients and carers, V stands for Vigilant Stakeholders. Now that term comes from a paper called Speaking Up in the ICU, the intensive care unit, and what it says is that families, vigilant stakeholders, may be the first to detect a change in a patient's clinical status. They can detect errors even those not apparent to clinicians. And you can see this in all kinds of settings. I have experience in looking after elderly relatives, and I've seen how, as a family member, you often have to help health professionals to join the dots, running back and forth between the hospital staff and the GP practice and the high street pharmacy and the home carers, trying to join up the appointments and the medications and the home visits and all the rest. And in hospital settings, family members might be spending more time at the bedside than busy clinicians. And they can be vigilant to changes in condition or demeanour because they know the patient intimately. This was powerfully and very sadly illustrated in the case of Martha Mills, 13-year-old girl who fell off her bike, went into hospital. Her parents, who were at her bedside, could see that she was deteriorating. But whenever they raised concerns, they were told that everything was basically okay. And then Martha died from sepsis. And at the inquest, the coroner said that Martha would probably have survived if doctors had heeded the warnings. It's a terrible story, but one really good thing that has come out of that is Martha's rule. That gives patients and families the right to request a rapid review if they're worried that a patient's condition is getting worse and their concerns are not being responded to. So patients and carers are not just passive recipients of healthcare. They're vigilant stakeholders. They can see things that sometimes clinicians can't. And when they speak up, we need to listen carefully.